My name's Paul Arnold. I'm a child and youth psychiatrist located here in Calgary. Um, and I have been working for many years, both in sort of research in child and youth mental health in general, but in particular in this area of like looking at the interaction between genetic and environmental risk factors. So kind of come to this both as a clinician and a researcher. Gina, maybe over to you just to do a quick intro of yourself.
I think many people know who I am because I'm
Right.
part of the network. But just really quickly, I'm a social worker by training and professor of social work, and um, just really delighted to have the opportunity to share a little bit about the work that we're doing. And I'm going to be speaking a little bit about some internships we're hoping to offer and engage young people who might be interested in working with us. And we're doing a lot of co-design work and really making sure that some of this research that we're doing, that it's culturally safe and really is respectful and really mindful of the historical and cultural violence that's been perpetrated against Indigenous people, and thinking about how data like this has been misused. And we really want to be able to move forward in a good way that really ensures that we are doing this in tandem with Indigenous colleagues. And Chris and NVIDIA are very much part of this work that we're doing as well, and have been supporting us along the way and co-creating what we're going to be presenting today as well.
Thanks, Gina. And yeah, again, thank you so much for mentioning that we do represent a large team. We'll kind of let you know sort of at the end. You'll see kind of all of our collaborators from across Canada. Particular gratitude to Chris and Vidya, and both for their work on this project and for bringing us here today. And Anika is our we have a really great team in terms of providing support, our research assistants and coordinators. And Anika, sort of a shout out to you for preparing these slides. Whitney, who's here today, is our research manager, who's kind of really really kind of driving force behind a lot of this work as well. But without further ado, so what we're going to be talking about today is the Pan-Canadian initiative linking genomic, environmental, and mental health data, and or PanGem for short, which is how we'll reference it for now. So yeah, I'd like to begin. As I mentioned, we're coming to you from the University of Calgary, and University of Calgary is located in southern Alberta, where it's beautifully sunny but very cold today. And we acknowledge and pay tribute that we are in the traditional territories of the peoples of Treaty 7. So Treaty 7 includes the Blackfoot Confederacy, comprised of the Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. And the city of Calgary is also home to the Métis Nation within Alberta, which includes Nose Hill Métis District 5 and Elbow Métis District 6. Next slide, please, Anika. So just by way of background, again, this will be completely familiar to all of you. The reason for all of this, though, just to remind us, is that mental health concerns begin early in life, and we estimate that 1 in 5 children and youth are affected in Canada, and that's with kind of at the level of clinically significant mental health disorders. If you look at symptoms that may cause distress, the numbers could certainly be significantly higher than that. So this is clearly an important problem, again, which will be of no need to introduce this group to that. Next slide, please. Importantly, though, multiple factors have been identified that influence the onset and development of mental health concerns, including the environment and genetics. And it's not nature or nurture, it's the two of them working together. And research has shown that differences in our genetic code or genetic variation are associated with mental health concerns. Next slide, please. Thank you. We've been working for a number of years, and sort of the research community has been looking at how genetics and mental health looking at the impact and the influence of genetics on mental health concerns to understand better how the genes and environment interact. And so that's both interacting how mental health concerns or disorders begin, And who may, in other words, who may be at higher or lower risk of developing mental health concerns, what those trajectories are. So, if, for example, if I'm seeing a young person, understanding what the likely outcome of the symptoms they're presenting to me today are. So, and that helps in terms of deciding who may require more support to manage a mental health concern and their response to treatment. Um, and one of the things that we can, and the first two issues around the onset of mental health concerns and the trajectories are still somewhat aspirational. There's a lot of work, discovery-based research to understand that, but in terms of kind of being able to take action, something that we can act on, where we have actually a little bit of traction is understanding who may be more responsive to particular kinds of treatments, particularly medications. So there is evidence that some genetic variants can have a significant influence on how your body reacts to particular medications. Next slide, please. So, the back by that sort of background and the information, the data that we have up until now, led us to put together this project called PanGem. This was in response to the Canadian Precision Health Initiative. And the Canadian Precision Health Initiative is a large-scale initiative funded by Genome Canada to better understand the relationship between genetics and diseases or disorders in the population of Canada. So it's very broad, and the intent is to and this very ambitious project to gather data on up to 100,000 individuals. Um, we put in an application and were successful to focus on mental health in children and youth. And that is the genesis of PanGem. PanGem consists of currently of a large number of research studies really coming together. So these are cohorts that were either already underway, so studies that were already underway, some led out of our group in Calgary, others from across the country, and a total of and either underway or we're just about to get started, and we're hoping to get genetic data from a total of just over 5,000 individuals over the next 4 years. We also are planning to develop a cohort specific to PanGem of just over 1,000 individuals, 1,200 individuals. These individuals will have genetic, environmental, and youth mental health data. So what the project does is actually funds the ability to look at the genetic sequence. So through a technique called whole genome sequencing, where we can actually get all of the genetic information on a particular individual, but we're gathering a lot of other information about their early environment, their mental health status, et cetera. And I won't go into detail across for the individual cohorts that's sort of in the fine print on this slide, but just to give you a sense of the scope of this, it's a large scale, ambitious study that kind of goes across the country. Next slide, please. And what are our objectives? What do we hope to accomplish from this? So first of all, we want to create a representative data set that combines genetic, environmental, and mental health data from children and youth, bringing together these different studies and using that combined data set to identify risk and protective factors for mental health concerns and treatment effectiveness. And most importantly, we want to turn those research findings into clear, practical guidance that providers can use in looking after their patients and clients. Next slide, please. And what do we hope to learn? We hope that we can use the combined data from mental health and developmental studies across Canada to identify new genetic variants that interact with the environment to influence the individual's risk of developing a specific mental health concern, their response to certain medications. So I mentioned we know a little bit about that, but there's a lot more that we could know. And particularly important for this group is we really want to engage with communities that have often been underrepresented in genetic research in order to generate research findings that actually represent the diverse Canadian population. And this is really important because to date, I mentioned that there's been a lot of genetic research, but unfortunately, it really has been biased. It has been largely consists of people who are overrepresented in some of our more specialized care settings who tend to be on average, and who are, who have participated in research, which tends to bias towards people of sort of European, Caucasian background, and this is not just true in Canada. This is sort of true kind of across the world. So we hope to sort of address that by having participants that more adequately represent the Canadian population. And why that's important is not just of academic importance, but it's also important because whatever we learn from this, we want it, when it comes to genetic findings, if it's based on information from a different population, it may not be helpful. For example, for Indigenous youth, if we identify, for example, a variant that impacts medication response, that may not be relevant for people who are from different backgrounds. Next slide, please. So how do we hope to use PanGem findings? We hope to support improvements in prevention, diagnosis, and treatment for Canadian children and youth, developing actionable plans and working with policymakers. We do have a policy arm to the program to influence changes in youth mental health care, advance accessibility of precision mental health care, and reduce care inequities by providing actionable information that represents the diverse Canadian population. Maybe I'll turn things over to you, Gina, because I think the next part is for you. Thanks, everybody.
Thank you so much, Dr. Arnold. So I'm going to be speaking a little bit about the co-design work, and which is one of our objectives as well. And I'll just begin by saying that a lot of this work has primarily been done through a Western lens. And so even the language and the way we talk about this is again through frameworks that really I think are the language, and again the frameworks probably don't resonate and are not applicable to, I think, Indigenous people. So we want to work collaboratively and co-design protocols or ways of working that recognize Indigenous ways of knowing and being, and methodologies and approaches. And so a lot of the work that we're doing in parallel is to really think about, like, how do we think about these issues? How do we talk about them in a way that isn't stigmatizing and alienating to young people? We believe that all young people have a right to participate in this kind of research, but we want to do it in a way that is culturally sensitive and safe, and that follows OCAP principles as well. Okay, so we can go on to the next slide. The team has worked carefully to elicit feedback from Youth Advisory Council about the internships that we have created. And I just want to share with you that we met with them in the early fall, and that we had an opportunity to hear from youth that it would be really important to ensure that we create a merit-based approach. That what we heard is that it's important to ensure that, when we post these positions, that we receive like have a rigorous process in place to ensure that that applicants can be selected based on their responses, whether they be through an interview or short essay. And that a lot of young people have felt in past experiences that a lot of opportunities like this get offered to young people through personal connection. So they wanted to know that, we were really putting in place rigorous processes so that it was an equitable opportunity for all young people to be selected, and not because of who they know. We also heard that it's important to create internships that are flexible, that recognize that not all young people are in post-secondary education. Some young people work full-time, work hours that, that are not 9 to 5, and that we ensure that, again, that these internships recognize the diversity of experiences that young people may have, and that the context of their lives may be very different. And then we need to be really respectful of that, and flexible, that these positions have to be paid. And then we also heard the importance of one-on-one mentorship, that a lot of young people have felt that sometimes these opportunities are extractive, and that, it's always about getting information that will help with engagement or with research, to think about even knowledge translation outputs, but that we really want to create opportunities through these internships that are going to give back to young people. They're going to help them to like really build capacity, skills, knowledge, to also set them up for success. So we heard that mentorship and supervision is absolutely critical, and that it especially, the mentorship needs to be provided by the primary investigators, and that they be offered again, Indigenous internships be off, that the supervision and mentorship is also provided directly by Indigenous scholars. And we also heard that youth want lots of opportunities for training and career development as well. There are lots of different positions. There's a position that'll be an internship position that will be focused on pharmacogenetics and policy research, and that'll be one position that will be available, that will explore guidelines around using pharmacogenetics with children and youth. There'll be another position that will be available that's just focused on genetic counseling communication. So how do youth feel that it would be important to share this information, again, in a way that recognizes the complexity of the science, but also that we're sharing this in a way that's youth friendly and sensitive to, like, again, different histories and contexts. And then there'll be a position that's focused on genetic and genomics research understanding. Very similar. If there are questions about these internship positions, I will invite Anika to speak to them tomorrow. We just wanted to like identify the various positions that will be available. And then there will be two positions that will be available, that will focus on cultural considerations for First Nations, Métis, and Inuit communities in genomic research. And this will be, again, creating internships that will provide opportunities to really explore the historical and ongoing concerns that Indigenous people have about the way that genetics research is done and how data could potentially be used. And then to think about, again, how to create a parallel process where we're really thinking about how to conduct research in a good way that is culturally informed and culturally sensitive. And then we will have a position that is an internship position that's for with a focus on cultural considerations for inclusive community engagement and genomics research. And then two positions that are focused on science communication. And then finally, one that's focused on community engagement. And all of these postings will be made available as soon as they're ready. And I believe that will be happening within the next month or so, Anika. Yeah.
Thank you, Chris. Thank you for the thoughts, and thank you for your involvement in this project as well, and to all of you for all the thoughts. I know we'll be following up with a number of you to follow up on some of these really helpful suggestions.